Yeah, well, about 1983 was when I first heard about AIDS, and I had to try vitamin C on it because it had been so successful with all the other acute viral diseases. Now, this turned out to be a key, is that AIDS is not an acute virus, it's a chronic virus. Uh, and So, but then I would take the people to bowel tolerance and get them off sugar and give them the zinc, manganese, chromium, selenium, cod liver oil, and the B vitamins. And it was definitely prolonging their life, but it wasn't curing it. Intravenous vitamin C would cut down the Kaposi sarcoma. It was pretty amazing. Early in the AIDS epidemic, at least half the people in San Francisco had Kaposi sarcoma. And when you gave these patients intravenous vitamin C, the Kaposi's would fade away. But anyway, see, I'm down the peninsula from San Francisco, and I was going up to San Francisco to treat these patients. And finally, it was getting too expensive for me, so we sort of came out that only the patients that came down the peninsula I would be seeing. Well, I had this one young gay guy who came in and approached me differently than anybody else ever had. He said, "I have a lot of money, I'll do anything you say." Well, I was waiting for this, and he hired special nurses, and he got intravenous vitamin C 60 grams a day. Oh, he came in with a T helper cell count of 5. And so he went on all this program I was describing. He was taking up to 200 grams of ascorbic acid a day, regularly taking 100 grams a day of ascorbic acid plus 60 grams intravenously. In 3 months, his T helper cell count was up to over 500, which was normal. And now, he's still alive today as far as I know. I saw him about 2 years ago. He was moving back east, and he was in perfect health, except that he was still HIV positive. At this point, I stopped seeing AIDS patients, because if a person comes to me and I can't afford to treat them and they can't afford the treatment, and the insurance companies won't pay for the treatment, then I just can't bear to treat the patients. So I wrote this up and sent it to various different gay magazines and try to get them to publish it, but they wouldn't.
And how long ago was it that you originally treated him when he came in with this count of 5?
It was about 1985.
20 years ago.
And he has actually gone up to, now understand, in 85 he had a T helper cell count of 5. So 3 months later he's over 500. He has been up, he's tried various different things. One thing he tried was this AZT, and early on the doses were so high that they knocked his white count down, way down, and so we had to save him with the triple B shots I was talking about. We got him out of that, and now he says he does go up and he gets the triple therapy in San Francisco sometimes, and he says he'd be sitting in the waiting room with his gay colleagues who are dying of liver failure and kidney failure and so forth from the drugs, and he says he's never had any trouble whatsoever with any of these poisons they give him because he takes these massive doses of ascorbate all the time.